the first speaker. Are you there, Dr. Jiyong?
Yes, I'm here.
Okay, 8 minutes for you.
Okay. Hello everyone, my name is KWAK. I'm from Gangnam Severance Hospital in Korea. Today I'll be talking about a case of pediatric vitreoretinal lymphoma focusing on initial presentation, treatment, and clinical challenges. So I don't have any conflict of interest to declare. So this case is from our Professor Christopher Lee, and it's a female 9-year-old who first visited us in April 2023. She had a history of bilateral uveitis from 2020, and sadly her mother died of brain metastasis of non-Hodgkin's lymphoma. And she had undergone diagnostic vitrectomy at a different hospital 3 months ago, and the biopsy showed diffuse large B-cell lymphoma. And she visited us for second opinion. In baseline, her visual acuity in her right eye was 8/20, IOP normal. She had keratic precipitates in her right cornea, vitreous opacity and cells, and hazy fundus in her right eye. Her left eye was otherwise normal, except that she had undergone vitrectomy. Previous imaging showed no CNS involvement, and PET scan done before vitrectomy showed FDG uptake in both eyes. And our plan was to do diagnostic vitrectomy in her right eye. Ultra-wide imaging showed very thick vitreous opacity, and that has been covering the angiogram in her right eye. And the vitrectomized left eye showed a diffuse pinpoint leakage. Just to show you the operation briefly. So as you can see, she has very thick veil-like vitreous opacity in her right eye. And Chris is finishing up the case with fluid air exchange. So we sent the vitreous for analysis, and cytology showed CD20 positive B-cell clusters suggesting DLBCL. Her IgH and IgK showed monoclonality. IL-10 over IL-6 was greater than 1. And NGS target panel showed mutations in CDKN2A, CD58, PRMDM1, and CD70. All these were tier 2 according to ACMG criteria. So this was a publication done by us 2 years ago. We did NGS panel sequencing of adult VRL patients. And 3 of the 4 mutations found in this young patient was among the common mutations reported for adult VRL patients. So over the course of a year, she had undergone 10 methotrexate injections in the right and 9 injections in the left. And both eyes did not show signs of recurrence. However, whether to begin systemic treatment required a multidisciplinary approach. And from May 2023, her MRI showed progression and regression of her lesions in the brain. By May 2024, she had developed new neurological sign, which was left facial palsy and left hand and foot coordination abnormality. And that's when pediatricians began referring her to neurosurgeons, and they did a brain biopsy. However, it showed non-specific focal gliosis with focal perivascular lymphocytic infiltration. And the neurologist began steroid treatment for CNS angiitis. However, in August, they stopped steroid because her autoimmune antibodies were negative, and there was no response on her brain MRI. And her brain imaging from August actually showed progression of lymphoma on lymphoma, and they started chemo for CNS lymphoma. And in September, the MRI showed favorable treatment response. And by November, she had finished 4 cycles of chemotherapy. And in December, she had undergone peripheral blood stem cell transplant. And until now, March 2025, her MRI results was favorable. So vitreoretinal lymphoma is a subset of CNS lymphoma, as you all know. And CNS lymphoma itself is very rare in children. And the incidence is only 15 to 20 cases per year in North America. And it's a non-Hodgkin's lymphoma with high morbidity and mortality. It's more prevalent in the elderly. And there has been only 4 cases of pediatric VRL in the literature since 1980s. Just to sum up, although rare, VRL should be ruled out in pediatric uveitis patients when they show bilateral involvement, curtain-like vitreous opacity, and maybe possibly family history. So this case was a first confirmed pediatric VRL patient diagnosed by both vitreous cytology and NGS. And NGS has proven invaluable for early diagnosis, and in our case, it was pivotal in confirming the malignancy. And a multidisciplinary effort from the initial evaluation is essential, as systemic involvement is common. And thank you all for